do you suspect that you may have post-traumatic stress disorder? And if so, how do you go about getting a formal diagnosis?
And once you've got that diagnosis, what treatments are available to help? So what is post-traumatic stress disorder? Well, you could have PTSD if you've ever been exposed to any form of trauma. Now, that might be something that's happened to you yourself personally, directly. It might be something that you've witnessed. It might be something that you've been told about. It can even be something that you've watched on social media. And then also you've got prolonged exposure. So for example, if you're maybe a police officer or an ambulance driver and you're seeing something on a regular basis, that can actually lead to you getting PTSD.
That could be prolonged or repeated exposure, and that can also be known as complex post-traumatic stress disorder. There's also another element to post-traumatic stress disorder, Eva, which is survivor's guilt, and that's typically if someone, for example, we actually worked, if you remember, Eva, we worked with a fireman who from 9/11, and actually he was supposed to work that day, but he didn't work that day, and because he switched shifts with a colleague, he had survivor's guilt because he believed that he sent that man to his death, which obviously wasn't the case, but that was survivor's guilt.
Yeah, and that really ate him up, and he really struggled with that. So how can you obtain an official diagnosis? Well, your first port of call must always be your medical health professional, your GP, and go and speak to them and tell them about what you're thinking, what you're feeling, and tell them about your symptoms. Now, they will assess you, and if you've had those symptoms for 4 weeks or more, then you're going to get referred to a psychologist or a psychiatrist so that they can give you a formal diagnosis.
Now, once you get a formal diagnosis, what happens from there in? Well, actually, there are three main types of psychological therapy. The first one is CBT, or cognitive behavioural therapy. The second one is a therapy called EMDR, which basically works on eye movements and desensitizes in that way. And the third one is group therapy.
Yeah, now if you're struggling in the short term and until you find a resolution, your doctor might decide to help you to manage those symptoms by putting you on medication. And obviously, so you need to speak to your doctor about that, let them advise you and sort of take their lead on that. Now, when it comes to children, because obviously, you know, nobody's immune to getting PTSD. So when it comes to children, usually the first sort of port of call would be cognitive behavioural therapy, or CBT, which is a talking therapy, generally somewhere between kind of 6 and 12 sessions. Now, if that's not successful, then your doctor or GP may then go on to actually refer them for EMDR, which is the eye movement therapy that helps to desensitize against the trauma that the child has experienced.
There's also alternative therapies which can work in conjunction with the previous therapies that we mentioned, or even stand alone. Therapies such as yoga and mindfulness.
Yeah, and meditation, and all those things are really good. And like Nick said, they're really good to do kind of alongside, because they can help you to feel more relaxed and more in control. But the great thing about those therapies is that they actually seem to help to release more alpha waves in the brain, and they help to make you feel more calm and more relaxed. Now, if you take a look around our YouTube channel, we've got more information about the therapies there that we've talked about. We've got more information about post-traumatic stress disorder and how to approach it. So do be sure to take a look around our channel. And of course, you know, we'd love you to come and join us. So do subscribe to our channel, become a part of our YouTube family. And if there's anything that you'd like us to film or you'd like us to talk about, then do please let us know. But just to conclude, if you're struggling, do please speak to your doctor because there is help out there and you can get better.